Hello, everybody, and welcome back to the podcast. Let's talk about SIBO because SIBO is something that I see a lot in my clients. I deal with a lot with my clients. And so let's talk about it. We're going to start by talking about what are the symptoms of SIBO. And then I want to go into mainly, I want to really talk about the causes of SIBO in this episode because a lot of people, where they go wrong with SIBO is that they don't figure out what the cause of their SIBO was, or their practitioner doesn't. And so they might actually get on top of it and they might feel better, but then they make the mistake of not figuring out and supporting the underlying root cause of the SIBO in the first place. So it just comes back. So SIBO is a small intestine bacterial overgrowth, and it occurs when there is an overgrowth of bacteria in the small intestine, and then that causes all kinds of symptoms. So the main symptoms are bloating and distension, classic hallmark sign of SIBO. You look 6 months pregnant, but you bloat very quickly after you eat. If you're bloating at the end of the day, then this can be more colonic. Okay, so that's when you need a stool test. And by the way, you cannot tell SIBO from a stool test. Anybody who has told you that you've got SIBO based on a stool test, they have misinformed you because you can't tell it. Okay, and you can't guess about SIBO either. If a practitioner has said we don't need to do a SIBO test, which is a breath test, we can just treat you because I think you've got it. I think that's not the way that I work because it's guesswork. You don't know how bad the SIBO is. When it comes to SIBO testing, you see gases, right? Hydrogen and methane gas, and how high they are is really telling us how bad your SIBO is. And that really gives us an indication of how long we need to do a protocol for. I think testing is absolutely imperative. Otherwise, you are flying blind. Like, let's do this properly. I understand that these tests cost money, but do you want to feel better or not? Like, let's do this properly. Let's run the testing. Let's see where you're at. Get the baseline. Let's run the protocol, retest, see where you're at. And we need to get those gases down to zero. So bloating, distension, particularly quickly after you eat, within like an hour or so. And then you can have gas, belching, acne, rosacea, other kind of skin conditions. You can have fat malabsorption. So you can have a greasy film in the toilet bowl or stools that float. This is a symptom of SIBO. Any kind of nutrient deficiency. However, if you've got really high B12 on a blood test result, serum B12, that can sometimes indicate SIBO. Stomach pain, cramping, nausea, acid reflux. This is a big one. Heartburn is a big symptom of SIBO, nausea, greasy, pale stools, like I said, this inability to digest your fat. The other kind of classic symptom of SIBO that goes along with the bloating typically is constipation or loose stools, usually one or the other. These are the main ones. Bad breath is always one. Brain fog and fatigue, huge with SIBO. When you've got gut issues, this really impacts your brain. Okay, so these are the main symptoms. So let's talk about what causes SIBO. So whenever I have a client who has SIBO, I give them this form so that we can really try to deduce what was the contributing cause so that we can correct it if we can. So first and foremost, gut motility and clearance is the most important thing. When it comes to SIBO, it's got to do with this issue, usually with the migrating motor complex, which has caused this sort of buildup of bacteria because you're not clearing the food through the small intestine properly. So many different things can lead to issues with this migrating motor complex and this slowing down of the migrating motor complex. So frequent antibiotic use. A history of lots of antibiotics is massive when it comes to SIBO. If you've had a bout of food poisoning, traveler's diarrhea, gastro issues, these can damage the nerves of the migrating motor complex and contribute to SIBO. If you drink alcohol a lot, this is no good for your migrating motor complex, can contribute to SIBO. If you've been diagnosed with diabetic neuropathy or type 2 diabetes or even type 1 diabetes, again, it's got to do with nerve damage. Abdominal surgeries. I know somebody who had abdominal surgery. They literally lifted out all of her organs and put them on the table and did what they needed to do and then put them back in. It was life-saving surgery. But ever since then, she's had tummy troubles, and she did do a SIBO test way back and it was positive. So she's probably still got some SIBO. That's a tricky one. And I think when it comes to these structural issues, which we'll get more into, if you've had hernia issues, gallbladder issues, abdominal surgery, if you've been in car accidents, if you've had whiplash, any kind of structural issue can contribute to SIBO. And those really, you need a chiropractor, an osteopath. You need some kind of physical manipulation to support the proper positioning of your internal organs. And that's obviously not something that I can help my clients with, but I always talk to them about that if that's what was contributing to their SIBO. Pancreatitis. or a dysmotility issue. I have a client who has gastroparesis, right? Let's see, medications as well, various different kinds of narcotic medication, opiates, things like this. If you've got Ehlers-Danlos syndrome, EDS, or hypermobility, this is commonly linked to SIBO as well. Being double jointed, hypermobile, this can be linked to SIBO. Then we have issues with stomach acid. So this can be a big one with SIBO if you are on a PPI. So I think we all know now, or at least, I think doctors are quite aware. They used to not be so much, but I think they're quite aware that these PPIs, they should not be taken long term. They're very damaging because they're lowering your stomach acid and they are a band-aid, right? So if you do have GERD, heartburn, whatever, whatever's contributing to that, it needs to be resolved. And the PPIs are just brought on for your comfort temporarily, but they're not addressing the root cause. And these PPIs, these acid blocking medications, they cause a lot of damage. They've been linked to some pretty scary pathology when you take them too long because they rob your body of your nutrients. And at the end of the day, I've been saying it for years, cellular health is health. And what makes a cell healthy is nutrients. Like all the biological pathways in the body, they tick because of nutrients. We're talking vitamins, amino acids, and minerals. So without those things, you're not going to be healthy. And these PPIs lower the stomach acid, and our stomach acid is what helps us break apart the amino acids in our protein so we can even absorb them, to absorb our nutrients, our minerals, our vitamins, etc. So PPIs can be very much an issue when it comes to SIBO and what caused your SIBO. Low stomach acid, hypochloridria is what we call that. And if you have heartburn or reflux, this can often be a bit of a ding 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 that you may actually have low stomach acid, not high stomach acid. Okay, what's next here? I think we already talked about food poisoning can be a real contributor to SIBO. Gastro events can be, right? Traveler's diarrhea. If you've ever been diagnosed with post-infectious IBS, that can definitely be a contributor. Antibiotics we talked about alcohol. And we also talked a little bit about underlying health conditions such as type 1 diabetes, type 2 diabetes, again, due to the damage that these conditions can cause to the nerves in the small intestine. Autoimmune conditions, Hashimoto's, rheumatoid arthritis, etc., can make you more vulnerable to SIBO. If you've ever been diagnosed with a gluten sensitivity, if you've got celiac disease, also very much contributors to SIBO. Crohn's disease, inflammatory bowel disease, thyroid issues. Thyroid issues are very, very, very common, especially in midlife. We start to see these thyroid issues ramping up. So you really want to do a full thyroid panel at least once a year. Just tick that box, keep your thyroid in mind. TSH, free T3, free T4, reverse T3, TPO, and TG antibodies. If you have thyroid conditions that run in your family, you're definitely more prone to them. If you've got a mother, a grandmother, a sister, an aunt who has thyroid conditions, really keep a keen eye on yours. They do on your thyroid because they do seem to be quite familial. And when you have got hypothyroidism, you've got this slowing down of everything. And that includes your digestion. That includes your stomach acid, right? And all of that leaves you more vulnerable to SIBO. Okay, other things to consider. We talked about abdominal surgeries, right? Car accidents, we talked all about that, whiplash, etc. Any anatomical abnormalities in your digestive tract can definitely increase your risk of SIBO. Diverticulitis as well. Bowel resections. Okay, let's see. Medications. Medications and stress are the last two, right? So we talked about PPIs, antacids. If you're taking these regularly, big issue, big problem there. You need to address what's going on. Contraceptive pill, other kinds of medications potentially can impact the migrating motor complex. There's all different kinds, right? Antispasmodic, opiates, the narcotics, antidiarrheal, metformin, other kinds of medications. You want to just sort of talk to your practitioner about which medications you're on and see if those may be impacting you and your SIBO. And then, of course, stress. I mean, stress, the nervous system is a huge one when it comes to all kinds of gut issues. You must get on top of that stress. A lot of people, I think, feel a little bit hopeless or helpless when it comes to stress. But really, this is where mindset plays such an important role, because life really isn't what happens to you. It's how you handle it. And whether you like to hear that or not, it's very empowering, right? So bad things can happen, but it's all in the way that it's all in your mindset and how you overcome those things. Now, day-to-day life stress is very important to get on top of. So when I work with my clients, I talk to them a lot about their stress levels and what we can do to lower or manage the stress. We can't always do much about the stress around us, but we can manage how we can deal with manage how we manage that stress. So deep breathing is a big one. I give my clients a few different kinds of deep breathing exercises that are very powerful, 100% free. Do them at any point, right? You got to find what works for you. Journaling, deep breathing, meditation, yoga nidra, which is not actually yoga, it's a meditation, getting out into nature, surrounding yourself by friends and family and people who love and support you. Very, very important, because chronic stress, anxiety, even PTSD, all these kind of things can lead to gut issues. So they need to be gotten on top of. Maybe you need to think about some therapy. EMDR is wonderful. There's multiple different kinds of therapy though, of course. So those are the main causes of SIBO. So make sure when you're working with somebody, when it comes to your SIBO, that they have given you a form so that they can figure out what caused your SIBO and that is being addressed, because otherwise you may get on top of it, but it may come back. So if you want my help, if you're listening to this in June, I do have some packages available. I only open up a certain amount of spots every month, and it really depends on my workload. And I do have some spots available at the moment, but once they're gone, they are gone. Because the way I work with women is very intense. It's one-on-one. I give you unlimited support. I go very deep into all things, not just your gut health. We talk about HRT. We talk about your diet, your lifestyle. We talk about everything, exercise, stress, so on and so forth. So if you're interested, grab a package. The link will be in the show notes. So if there's still a package available, go grab one. You can also come over and speak to me on Instagram. I am at Tara Thorne Wellness. And if you come into my DMs, you can just say, hey, I'm interested in working with you. This is what I'm struggling with. And then I'll come back to you. Often I'll do a voice note and we can just have a little bit of a back and forth, a little bit of a conversation about what's going on with you. What have you maybe tried in the past? What has worked? What hasn't? And I can tell you all about what I have on offer and if I think that we are a good fit to work together. Okay, so either head over to Instagram and DM me or head to the show notes and grab a package if there are any left. They have sold out the last 2 months. They will probably sell out again this month. So just keep that in mind. That's it for today. And if there is anything that you would like me to talk about on this podcast, just again, come over to me on Instagram and just DM me and let me know. Let me know what you'd like me to do episodes about. And I really do appreciate it if you share this episode out, because that's the only way that this information is going to get out to other people who need it, is if you subscribe and you leave a review and you share it out with people that you think they might benefit from this information. That's it for now. I will talk to you again on the next episode. I am not a medical professional, and the information provided in this podcast is for informational and entertainment purposes only. I do not have access to your individual medical history or circumstances, so the content discussed here should not be considered as medical advice. Before making any changes to your diet, lifestyle, or considering the use of supplements, please consult with a qualified healthcare professional or your doctor to ensure it's safe and appropriate for your specific situation. Any decisions you make based on the content of this podcast are at your own discretion and risk. Thank you for tuning in.